Coming to hypertension, hypertension refers to a condition in which value of systolic blood pressure is persistently more than 140 mm of mercury and that of diastolic blood pressure is above 90 mm of mercury. If there is an increase in only systolic blood pressure, it is called as systolic hypertension, and in which the pulse pressure is raised. Types of hypertension. There are two types of hypertension, primary and secondary hypertension. Primary hypertension is also known as essential hypertension and is characterized by raised blood pressure without any underlying disease. Risk factors for primary hypertension include hereditary, obesity, mental tension, and smoking. Whereas secondary hypertension refers to a condition in which blood pressure is raised due to some other underlying disease. Common causes of secondary hypertension are cardiovascular diseases like atherosclerosis, renal diseases like glomerulonephritis, and tumor of juxtaglomerular cells leading to formation of excess of angiotensin II. And it could be also because of endocrinal disorders like hyperaldosteronism, pheochromocytoma, and Cushing's disease, that is excessive secretion of glucocorticoids from adrenal cortex. Neurological diseases may also produce hypertension, include raised intracranial hypertension, and also the pregnancy-induced hypertension is noticed in some of the pregnant women, which leads to secondary hypertension. Some of the complications of hypertension are the left ventricular hypertrophy, cardiac failure, ischemia, and myocardial infarction to the cardia, and some of the CNS conditions. It can lead to cerebral hemorrhage and stroke. It can also affect the renal system where retinal conditions where it leads to hypertensive retinopathy and papillary edema, and it can affect the renal system by causing or leading to renal failure. The treatment of hypertension, where primary hypertension is treatable but it is not curable. Some of the modalities are salt, calorie, cholesterol, and saturated fat restricted diet, and avoidance of alcohol and smoking, modifying the lifestyle, and some of the drugs like two general classes of drugs are usually used. They are vasodilator and natriuretic or diuretic drugs. And other drugs used for the treatment of hypertension include antiadrenergic drugs, ACE inhibitors, and calcium channel blockers. Whereas secondary hypertension is only treatable, but sometimes it is not only treatable, but sometimes it can also